Hi, I'm Dr. Jeffrey Riopelle, and thanks for joining us today. What I'd like to talk to you about is the silhouette suture. The silhouette suture is a very unique technology that allows us to lift the face without doing any major surgery, such as a facelift. So facelifts have their place. If someone's quite loose and needs a lot of lifting and tightening, then the facelift is a great way to go. But it has the downside that it has a 4 to 6 week recovery, and it's fairly invasive and often requires being asleep. There's another great procedure that's a little mini surgery that can be done simply in the office in a fairly short period of time, called the silhouette suture lift. The silhouette suture lift is sort of the third generation of sutures that create lifting without actually dissecting the skin and tying a lot of knots. So as a result, there are actually no incisions in the face itself, and yet it can lift the mid-face, lift the brows, lift the neck, and also lift the jowls. I actually have a silhouette suture here, and as you can see, it's a needle with a thread, and on the thread are these little tiny protein particles, protein cups. The purpose of the cups is actually to grab the fat and connective tissue under the skin and lift it up without having to suture to it, thereby lifting the face. So the way that we do a typical silhouette suture lift is, for example, if we're going to be working on lifting the mid-face, the nasolabial fold, we'll make a little tiny incision inside the hairline where it's not visible and place the silhouette suture needle through the skin, so that the suture is actually placed in the skin in the subcutaneous fat tissue, and then a second suture is placed right by its side. Now those two sutures are then tied with these little knots after catching the fascia, the subcutaneous connective tissue, with this little needle. And by tying two together, we can actually lift the skin and tie it in place such that it's held in suspension, creating the lift that we desire. Now these little protein cups are uniquely designed because they'll actually dissolve after 6 months. As time goes, you actually grow collagen, your own collagen, in between the cups. And when the cups dissolve, they're gone, and you still have the lift because you've created your own collagen in its place. So the silhouette suture can be done on a Friday, and one can go back to work on Monday. That's a fairly short recovery time. There is an initial cup, sort of cupping up of the skin up toward the top, but your skin actually resolves and reabsorbs that area so it looks nice and smooth with time. As I mentioned, it can be done for the brows, it can be done for the nasolabial folds, for the jowls, and also for lifting the neck. And it's a great alternative to a facelift if someone is not quite there where they need a facelift yet, or if one just cannot afford the downtime of 4 to 6 weeks recovery but can afford a weekend to quickly recover.